The major thing which we are going to talk about today will be how and why people get infectious disease and types of bacterial infections. We'll also talk about mainly the stages of bacterial pathogenesis and the determinants of bacterial pathogenesis which are responsible of causing infection, namely transmission, how it is transmitted from a host to host, and then how this adherence occurs to the cell surfaces, how these bacteria invade and cause inflammation, and sometimes in certain bacteria they are able to survive intracellularly. Then, in the next class, we'll talk about toxin production and immunopathogenesis because it's a vast topic. So, this pathogenesis of bacterial infections has been divided into two lectures. So, this is the part one of the two lectures, and we'll discuss up to the invasion and inflammation, but we won't discuss toxin production and immunopathogenesis in this one. Also, these bacterial infections associated with cancer and different strains of bacteria, how they produce different diseases and typical stages of the infectious disease, we'll come to that in the second lecture, not in this one. So, first, infection and disease, we'll certainly talk about certain definitions and generalized stages of infections. These definitions will be important for you to make your concept clear. And also the virulence factors and toxins. As I said, toxins will be discussed in the next class. So, what is a disease? Disease is any deviation from a condition of good health and well-being. And what is infectious disease? A disease condition which is caused by the presence or growth of infectious microorganisms or parasites is called an infectious disease. Then, what is pathogenicity and virulence? Pathogenicity is a trait of a microbe to cause disease. It's the ability of a microbe to cause disease. And this term is often used to describe or compare different species of microorganisms. On the other hand, virulence is the degree of pathogenicity in a microorganism, and this term is used to describe or compare the different species, different strains within a species. It will come clear as we move on. Okay, there are certain terms we use: acute infection and chronic infection. What is the difference between them? Acute infection is an infection which is characterized by sudden onset, rapid progression, and often with severe symptoms. On the other hand, the chronic infection is an infection which is characterized by delayed onset and slow progression. Then we have also encountered certain terms like primary infection and secondary infection. What is the difference between these? Primary infection is an infection that develops in an otherwise healthy individual the first time you are getting that infection. While secondary infection is the infection that develops in an individual who is already infected with a different pathogen. So that is a secondary infection. Then there are terms called localized infection and systemic infection. What is a localized infection? A localized infection is the one which is restricted to a specific location or region within the body of the host. While systemic infection, then on the basis of clinical conditions, they can be a clinical infection or a subclinical infection. Clinical infection is the one which is obviously observable or detectable symptoms. You have fever and clinical signs and symptoms. That's a proper clinical infection. While subclinical infection is the one which has got few or very limited or no obvious symptoms, which is under latency. That is a subclinical infection, which is not giving the proper overt symptoms, full-blown symptoms नहीं आ रहे होंगे. Then, what is an opportunistic infection? Opportunistic infection is an infection caused by microorganisms that are commonly found in the host environment. It is right there in the host environment, but it sometimes waits for the immunity of the host to fall down and then it strikes. And this term is often used to refer to infections which are caused by organisms in the normal flora in certain susceptible populations. For example, we all are harboring staph species on our skin, but we are not getting infectious. But if somebody has got burns or somebody has got some immunodeficiency, that same staphylococcus which is residing on your skin can become a cause of opportunistic infection because the person or the host becomes susceptible. Now the suffix emia. You must have encountered a lot of these terms ending with emia, emia. It means the presence of an infectious agent. For example, bacteremia. That means the bacteria is lying in the blood. So that is presence of that infectious bacteria in blood. Viremia is presence of virus, infectious virus within that host. Then there is fungemia. Fungemia is the presence of infectious fungus within the blood. And septicemia is presence of infectious agent in the bloodstream which is causing full-blown symptoms. That's called septicemia. So these suffix emia has got different meanings, and the words bacteremia, viremia, fungemia, septicemia should be clear to you. Then there is a term called itis. You must have heard about it, appendicitis, cholecystitis. What does it mean? That means the inflammation of that particular part. For example, pharyngitis is inflammation of pharynx. Endocarditis is inflammation of the heart chambers. And gastroenteritis, like diarrhea, is the inflammation of gastrointestinal tract. So the term itis should be clear to you. Now, epidemiologically, there are certain terms used. And this epidemiology is the study of the transmission of disease. And they are mainly divided into communicable diseases and non-communicable disease. Communicable disease is the one which can be transmitted from one individual to another individual. And all infectious diseases are communicable disease. On the other hand, non-communicable diseases are the ones which are not transmitted from one individual to another. Like that. For example, if somebody is hypertensive, it cannot be transmitted to a person sitting next to him. That person will also become hypertensive because it's a non-communicable disease. Or if somebody has a history of stroke, then the person sitting next to him will not become a patient of stroke because it's a non-communicable disease. While if we are talking about an infectious disease, they can be communicable disease. They can be transmitted from one individual to another. Now, there are certain terms used on the basis of occurrence in a certain populations. These are called endemic disease, when a disease condition that is normally found in a certain percentage of a population. For example, we know that typhoid, unfortunately, is endemic in our country or in South Asia. And malaria is an endemic disease in our part of the world. These are already occurring in a certain percentage of population. While epidemic disease is the one which occurs in a greater than usual percentage of a specific population. For example, these days the epidemic which has become a pandemic is corona. It has become in a greater than usual percentage. Usually these coronaviruses were not very potent to get spread beyond their expected percentage. But now they have a greater amount or greater than usual percentage in this specific population. Pandemic disease is the one which is spread globally. The whole country, the whole world is involved, and it is an epidemic affecting a large geographical area, often on a global scale. Example again I'll give of corona because it was initially an epidemic starting from China and certain pockets of the world, but then it had the potential to spread very widely, involving a lot of different populations in different geographical area, and it became a pandemic. That's why it involved on a global scale. What is a reservoir of infection? This term should be clear to you because in infectious disease, certain animals and certain hosts have to serve as reservoir. Reservoir is like a source of infectious agent which serves as a potential source of spread. And a carrier is the one individual who carries an infectious agent without manifesting symptoms and yet who can transmit the agent to another individual. Certain organisms serve the purpose of being a carrier, but they are not the reservoir. Reservoir have to harbor and keep reproducing that infectious agent and being served as the a potential supplier of that infective agent, while carrier is the one who is transmitting, and it is the one that does not manifest symptoms, and it just transmits the agent to another individual. And what are fomites? Fomites are any inanimate objects which are capable of being an intermediate or indirect transmission of an infectious agent. For example, bedding or certain inanimate things which are just serving as potential source of spread of infection. Okay, now we'll come to the direct mechanisms of disease transmission. How these infectious agents spread from person to person. For example, certain skin diseases, they are spreading by direct skin contact or by aerosols which are airborne. And indirect mechanisms of disease transmission are, for example, food and waterborne transmission like typhoid and gastroenteritis, rotavirus. All these are food and waterborne disease. These are indirect transmission. If certain things are transmitted by fomites, like inanimate things, like by bedding or by contaminated, soiled surroundings, these are indirect mechanism of disease transmission. And if the certain diseases are transmitted by animal vectors like mosquitoes or ticks or mm, uh, of any parasite, then they are also indirect mechanism of disease transmission because they are not directly transmitted by aerosol. They need an animal vector for their transmission. So these are the terms which are usually used in the study of infectious disease and how their pathogenesis is studied. And we have kind of come across a lot of them. What is bacteremia? Bacteremia is the bacteria circulating in the bloodstream. Colonization is establishment and growth of a microorganism on a body surface. Like our respiratory tract is colonized, our genital areas are already colonized with certain microorganisms. So these are colonized sites. What is a disease? Disease is a noticeable impairment of a body function. What is immunocompromised? Immunocompromised is a host with weakness or defect in the innate or adaptive defense. What is inapparent infection? Which is not apparent, which is not obvious. We already talked about infectious disease. This is a disease which is caused by infective microorganisms or virus. Latent infection, latent means hidden. Latent infection is the one which is present there but is not active. It is hiding. That is why it's called a latent infection. It is not in an active state. What is an opportunistic infection? Opportunistic pathogen? We already talked about it, that these are organisms that cause disease only when introduced into an unusual location or into a susceptible host or into an immunocompromised host. And what is a parasite? Parasite is an organism that benefits at the expense of another organism. And what is a pathogen? Pathogen is any disease-causing microorganism or virus. What is pathogenic? Pathogenic means disease-causing. Secondary infection is an infection which is an additional infection that occurs as a result of primary infection that occurs during or immediately following the primary infection. Septicemia is an acute illness caused by infectious agents or their products circulating in the bloodstream. What is a systemic infection? Systemic infection is a widespread infection through blood or lymph. Toxemia is the toxin circulating in the bloodstream. Viremia is the virus circulating in the bloodstream. And what are virulence determinants? These are the attributes of a microorganisms that promote pathogenicity. So these are the terms which will be coming across when you are studying communicable or infectious disease. Now, what is an infectious dose of an organism? Infectious dose, it varies greatly among different bacteria. For example, Shigella and Salmonella, they both cause diarrhea by infection of the gastrointestinal tract. But the infectious dose of these organisms is widely different. In case of Shigella, only less than 100 organisms can cause dysentery. While in cases of typhoid, which is Salmonella, more than 100,000 organisms are needed. So the infectious dose of Shigella is low. Only low organisms can cause this disease. While of typhoid, the infectious dose is higher. 100,000 microorganisms are needed to cause enteric infection or typhoid. And bacteria that are human pathogens, some of them serve as obligate intracellular. Okay, class. Hopefully, we'll start my audio here and will not have any problems. The determinants of bacterial pathogenesis are being discussed, which starts from transmission of the infecting organism. It adheres to the cell surfaces and then invades, causes inflammation, and in certain species, there is intracellular survival of that bacteria. Then the other factors which are important in pathogenesis are toxin production and immunopathogenesis, but that will be discussed in the next class, which is coming on Thursday. Meanwhile, for these are the important modes of transmission, whether they are human to human or from non-human to human. In human to human, the important features are by direct contact, especially in cases of sexually transmitted diseases, in cases of food and waterborne diseases, fecal-oral, like which causes dysentery. Transplacental mode of transmission is important in congenital syphilis, which is a sexually transmitted disease, and blood-borne diseases, obviously hepatitis B and C. Non-human to human will be in cases of soil source, tetanus is there, water source causes Legionnaire's disease, स्पेशली एयर कंडीशनिंग वाले जो लोग होते हैं जो कि ज़्यादातर एसी में बैठे रहते हैं उनके अंदर ये कॉमन होता है. Then the diseases which are through animal source can be because of because of the direct interaction with the animal, like cat scratch disease, or It could be by a vector involvement like Lyme disease, in which ticks are involved, or in cases of fecal contact of the cattle, there can be hemolytic uremic syndrome caused by E. coli. And obviously, fomite sources because of dirty bedding and dirty clothes, it could be staphylococcal skin infection. So, these are the important modes of transmission. And there is a chain of transmission. How these bacteria enter the portal of entry, whether it's any portal, respiratory tract or GIT tract, and conjunctiva or skin, then they penetrate the host defenses and then ultimately lead to damage to the host cells or by causing cytopathic effect in cases of certain bacteria. Now, the portals of entry mainly are mucous membrane, skin, and parenteral root. Mucous membrane can be of the genitourinary areas or respiratory areas, because these are colonized sites. First, there is attachment to the host tissues, which leads to production and delivery of various bacterial factors. Ultimately, it leads to replication and evasion of the immunity, and it will cause damage to the host cells. So, these are the molecular determinants of pathogenesis. So, for the mucous membranes, respiratory tract is the colonized site, and microbes inhaled into the mouth or nose in the droplet of moisture or dust particles are inhaled there. And this is the easiest and most frequently traveled portal of entry. Then the common diseases which are transmitted is common cold, flu, tuberculosis, whooping cough, pneumonia, measles, diphtheria, even these days coronavirus, all these are transmitted by respiratory tract. Then other tract will be gastrointestinal tract, in which the orophycal route is used and the microbes gain entrance through contaminated food and water and finger and nails. And these microbes can enter the GI tract, are usually destroyed by the hydrochloric acid of the stomach, but certain bacteria do survive. And common diseases which are contracted by the gastrointestinal tract are salmonellosis, which causes typhoid, which is caused by Salmonella typhi. It could be shigellosis, which causes dysentery, and cholera, which is caused by Vibrio cholerae, and ulcers, which are caused by Helicobacter pylori, and botulism, which is caused by Clostridium botulinum. It's mainly common in infants and people who utilize canned food a lot. It's more common in those people. So, these pathogens enter the GIT at one end and exit at the other end. They are excreted by the feces, and they spread by the contaminated hands and fingers. That's why hand hygiene and hand washing is very important. So, these are the gram-negative diplococci of Neisseria gonorrhoeae, which causes the sexually transmitted infection, and these are Syphilis Treponema pallidum species. These are not gram-stained, these are only silver-stained. These are very small bacteria. Then there are chlamydia, which are even smaller and they survive intracellularly. Then HIV is a virus, and obviously it is also encountered by mucous membranes of the genitourinary system. And herpes simplex 2, all these pathogens which we have mentioned here in this slide, they cause genitourinary infection or sexually transmitted disease. Then certain mucous membranes are involved of conjunctiva, which can cause infection of the conjunctiva, causes conjunctivitis. Specifically, trachoma is also occurring. It can be also transmitted from mother to baby. Okay, now the portal of entry, which is skin, which is the largest organ of the body. But if it's unbroken, it can lead to a lot of infections. And the microbes can enter through the openings in the skins like hair follicles or sweat glands. This is another picture of skin and the ducts of the eccrine glands. Okay, now the third portal of entry is the parenteral port of entry. Under the microorganisms are deposited into the tissues below the skin or mucous membranes, and punctures and scratches are responsible for causing that. And also it can be transmitted by injections, bites, and due to iatrogenic infections caused by surgery if the proper infection control measures are not taken place. And just because a pathogen enters your body, it does not mean that it's going to cause disease. It has to have a certain amount and it has to survive within the host environment. And pathogens have different preferred port of entry. So like Streptococcus pneumoniae is a respiratory pathogen. If you have it in water or food, it will not cause any infection. But if it's inhaled, it can cause pneumonia. And if it's entered the GIT, it does not cause any disease. Similarly, Salmonella typhi will cause typhoid or enteric infection. But if you're inhaling it, it's not going to cause any problem. Or if it's on the skin, it will not cause disease. But it can be transmitted if you're not washing your hands. And the number of invading organisms is very important. That's why the concept of lethal dose and infectious dose comes into action. Infectious dose required to cause disease in the 50% of tested animals. Examples like infectious dose of Vibrio cholerae is 10 to the power 8 and infectious dose 50 of anthrax is only 5,000 to 10,000 spores. So it is different for each microorganism. And how do bacterial pathogens penetrate host defenses? First of all, they start to adhere. All pathogens have a means to attach to host tissues. By means of adhesins or ligands, they first adhere to the host tissue. And after adhering, there are some cells having fimbriae which can cause a roll and tissue tropism. For example, Candida is there in vaginal epithelium or oral epithelium. That's why it causes candidiasis in oral thrush in the mouth, as well as vaginal candidiasis in the females of the reproductive age. So these are the picture of fimbriae of the Neisseria gonorrhoeae or enterogenic E. coli. They are similar, or Bordetella pertussis. And bacteria typically employ proteins which are called adhesins to attach to host cells and which are located usually on the ends of the fimbriae. And alternatively, these adhesins can consist of glycocalyx. These are the pili with adhesins and host cells, glycoproteins receptors for pili. Okay, other factor for microorganisms is the presence of capsule. A large capsule is antiphagocytic. Here is shown a gram-stained picture of Klebsiella pneumoniae showing a large capsule which prevents phagocytosis, causes attachment. It is also present in Streptococcus pneumoniae, which is a cause of pneumonia. And also present in Haemophilus influenzae, which is also again a cause of pneumonia and meningitis. And it is also present in Bacillus anthracis, a very large capsule. And Streptococcus mutans of our mouth is also a capsulated organism. And by means of these capsules, they avoid phagocytosis. Other cell wall components which cause these bacteria to be virulent are M proteins and waxes or mycolic acids, which are present in Mycobacterium tuberculosis that helps in resisting digestion after phagocytosis. That is why these Mycobacterium tuberculosis are able to multiply inside WBCs. Okay, now we will come to enzymes which are secreted by these certain microorganisms like coagulase, collagenase, DNase, hemolysins, hyaluronidase, hydrogen peroxide, leucocidins, sporins, pyrogenic exotoxins, streptokinase. These are the microbial products and these are the virulence factors of these bacteria which help them in causing disease in the host cells. Leucocidins are these are the products which attack certain types of WBCs and they kill the white blood cells which prevents phagocytosis. And it releases and ruptures lysosomes, and lysosomes are the ones that contain powerful hydrolytic enzymes. But if lysosomes are ruptured, here again it's a picture of hemolysins which cause the lysis of RBCs. That's why streptococci are also classified accordingly: alpha hemolytic, beta hemolytic, non-hemolytic on the basis of hemolysins or their presence or their absence of it. So, alpha hemolytic streptococci secrete hemolysins that cause incomplete lysis or RBCs. Here you can see alpha hemolytic streptococci. And if there is complete lysis, there is clearing around the cells. And if there is no secretion, these are called non-hemolytic or gamma hemolytic hemolysins. Other enzyme which is secreted by bacteria is coagulase, and it helps the blood to coagulate. It's a property specifically of Staphylococcus aureus. These blood clots protect the bacteria from phagocytosis from WBCs and other host defenses. And Staphylococcus aureus is the prime example of coagulase positive staphylococci. And fibrinogen converts into fibrin and a clot is formed. Then another product of bacteria are kinases. These are the enzymes that dissolve the blood clots, and most commonly streptococci are the ones that produce it. It's called the streptokinase. Streptokinase is also used therapeutically in cases of heart attack victims when you have to lyse the blood clot. So it is also produced in lesser quantity by staphylococci. It's called staphylokinase, and by the means of these kinases, these bacteria are able to spread in the blood and cause bacteremia. As I mentioned, streptokinase is used to dissolve blood clot in the heart attack victims. Another enzyme we have to discuss is hyaluronidase, which breaks the hyaluronic acid which is found in connective tissue, and it is also known as a spreading factor. It is mixed with a drug to help spread the drug through a body tissue. Streptococci, staphylococci, clostridia and pneumococci, they all have got hyaluronidase. Another enzyme is collagenase, which breaks down collagen. It is found in many of the connective tissues. Prime example is Clostridium perfringens, which is used which causes the gas gangrene. This is a picture of severe gas gangrene caused by Clostridium perfringens. Talk. Khuda Hafiz. Coming towards the end, there is another enzyme called lecithinase which destroys lecithin and allows the pathogen to spread. It's a property of Clostridium perfringens. So, in summary, what we discussed today is how bacterial pathogens penetrate the host defenses by means of different virulence factors. They adhere to the mucous membranes by means of fimbriae, or they might have capsule. If they are capsulated, they secrete certain enzymes which we discussed like leukocidins, hemolysins, coagulase, kinases, hyaluronidase, collagenase. These are the enzymes which are secreted by bacteria, and necrotizing factor, lecithinase, and these help them establish infection in the host. So this is the end of the part 1, and we'll discuss the toxin production and how these bacteria are invading the host in the second part of our